WHO and also there be me check it that journalist that why not Ghanaian name. Our claim say president
and I
say a massive plan. He's going to fight it. And so they bought it.
Especially and yet limited to maybe nipa bit my interface with them and yet church members and yet your community when to community. Now you're on social media. I'm for a use of the internet not to influence these things. Approach citizen for Obia will lead a co-congregation. Christo for your was our mindset we say. Approach Ben bit media handle, sir, myths and misconceptions.
Number one, and yet one-sided fight. That's what we ought to know. Because at the same way, attacks in one-sided. Sounds not solution into one-sided.
That's right.
Until we have, to say, a war, your ground war, and you will see, and you war air, and you war, to say, cry, digital, and I say, other cyber,
yeah,
and biological, nominating. Until you need to see the different phases of the war we are in. Until you prepare adequately for each of these things. Until for us, as a church community and as a religious community, we control a lot of people. Over Ghana has here, for the Christian percentage of about 70 plus, now the Muslim, 15, and also Kama, you account for about 85 to 90% of the population. Kasa, members, so we will do what we can within our context. Now, the religious argument I make, our 666 side,
that's right.
No, you shall, yes, you will know the truth, and the truth will set you free. My people perish because of lack of knowledge, as in the Old Testament. That is true. The knowledge be available. Now, you can't knowledge, biblical knowledge, one. Spiritual, as for example, we almost say 666. But what kind of Revelation 13? Does it say the 666 will be offered on your blind side or not? That's not what it says. That man, revealing, also that man, what power, economic power, political power, near dinner. For baby known.
Through a vaccine.
No,
through
a vaccine.
Or hide behind BB no idea.
Read the scriptures and you understand. Say, that person will be made known, and then it will be made clear. Say, ni pass wow no. J. Sad dear.
Or physical, face to face.
Yes.
One fancy. Yeah. Don't go behind the vaccine and I say COVID-19.
Hidden.
Revelation
chapter 13, from verse 11. Then I saw a second beast coming out of the earth. It had two horns like a lamb, but it spoke like a dragon. It exercised all the authority of the first beast on its behalf, and made the earth and its inhabitants worship the first beast. You see, so there's worship taking place before Christ mentioned 666 is known.
Okay,
the one will summon the agent, the Antichrist, and then the master agent, then it performed great signs. What first and most one day and Kunya and I say assembly at this stage. Let me finish. So, and great signs, even causing fire to come from heaven to the earth in full view of the people.
In full view
of the people. NIV. Also, because of these signs, of the signs, it was given power to perform on behalf of the first beast. It deceived the inhabitants of the earth. It ordered them. By the time I drew point, whatever. No. Now, Obianim said, then we ordered them. Okay. It ordered them to set up an image in honor of the beast. Also, who was wounded by the sword and yet lived. Verse 15 was saying, the second beast was given power to give breath to the image of the first beast, so that the image could speak and cause all who
I understand
worship him. So that you end on the 666. It also forced all people, great and small, rich and poor, free and slave, to receive a mark on their right hands or on their foreheads. See, also he forced. Let's just say, you're the force. This is not a force. There's nothing about this thing which is force.
So this the coming of the 666, whatever myth, I'm going to vaccine from the other two. That's the point I would drive at.
The point is that the context that in which the 666 man is revealed, it's not what we are seeing.
Right. So, Yashas here with the charismatic leader. The big question is, even some of the ministers in this case, I was a mate with was a challenge with some vaccine in terms of spirituality and the can they have a common front? Even if the religious groupings leadership are ready, so push it na vaccine. Does it transcend a coffin, especially to the other members of the clergy? Yeah, almost bit me a congregation advise there to or so more and conquer vaccines. These are some of the questions that maybe let's go back to him now. Exactly. Now, some of the ministers, people that are even like you, Omokra would doubt about it. It means they only come on front to give this education. How better than to me the common front in the Christendom, not religious groupings, no near to me, I sensitize Ghana for a demystify our conception as a bonsamadia.
Well, as for we are dealing with numbers. In Ghana, the Dominical front is very united. It can leadership. Christian Council, Catholic Secretariat, Charismatic National Association of Charismatic and Christian Churches, Ghana Pentecostal Council, and all the other affiliate groups in we are Muslim councils. We are united.
Okay.
It's Ahmadiyya, Ghana Muslim Representative Council. So all the groups are united, including our traditional leaders and so.
Okay.
So in that sense, as groups, they were united. But of course, so subjective, Sano. You won't get one or two exceptions, but those are really the minority.
And those why I read me sure anytime because also Benjamin. That's right. Now, my chance in free FDA. How have you been involved? AstraZeneca. Okay. How have you been involved? And my president Yakasa will make you reference to the Food and Drugs Authority. Some more magiatum, say a drone here. The Ghana for and Concovo. And then I'm here, I'm That's
it. In check is why it's safe in na anope. Na that's to say, Mama FDA so akonya say anope to me and publicly educate you more about vaccine. The vaccine they beboa because he had the papa. Now, as the President, His Excellency, said, Endrano, the Food and Drugs Authority, we are mandated by the Public Health Act to make sure, say, in road, they are safe, efficacious, and of good quality.
Okay.
Now, we have different processes that you go through to certify this. Now, when it comes to the drugs, now, the main things we do is that routinely, we'll go and do site inspection. They will review the documentation. Send documentation on it. Analysis of it. Now you can say, okay, this a drone, a good, efficacious, of good quality. Now yes, we are a drone no. Now you are jatuno. Once our market national, you will continue. Na ya monitoring. I should say a drone. Send the say and one year. Now be on fake ne counterfeit the bemo. Into the COVID-19 vaccines, no, you say play the same role. To make sure, say, there are no Ghana for any amount for hina. Into Ghana for say here vaccines nibi. But before able to say vaccine chrono, I say who's a vaccine no efficacious and of good quality. Into the same process they go through. And what happened is that with the vaccine, the AstraZeneca vaccine, they made an application through the COVAX, and then you review documentation.
What they are here for?
So the application is made by. It's part of the COVAX initiative.
Okay, so manufacturers not end the application, no? Who made the application to the FDA?
The application was made by the manufacturers.
Okay.
But with the COVAX, because it's the COVAX WHO organized program, the WHO that will make sure that they have reviewed the documentation and then they will approve it and say it's part of the COVAX. And some decided they also offer it to the country. But the country has to also review it on their own to decide say good for their people.
Good. So that is the process. Yes. At the end of FDA, especially AstraZeneca,
okay.
You confirm is Ghana for.
Good. And you receive the application. No? The application was mainly the documentation that has been done on the vaccine manufacturing. And to review, it said, send them develop a vaccine, no? Send them change it from the virus itself to get the finished product in the bottle. How the bottle was made, whether bottle interact with the vaccines or not. It reviews our process. They review clinical trials on the vaccine itself.
More review the documentation.
The documentation.
And as they say, what about the clinical trial?
The clinical trial. The clinical trials also is the documentation on the clinical trials.
It's a documentation?
Yes, on the clinical trials that have been done. And to come from animal studies, then to go to human being studies. And to be reviewing and who say, indeed, this documentation that they've provided on the vaccine, it's sound. Then we made the decision that because of what they've submitted, we can go ahead to agree for the product or the vaccine to be used in Ghana. But
where your documentation and manufacturing are submitted amount? We then wait me I authenticated the veracity. We bit my validate it, say indeed. Documentation or the amount, the processes were gone through practically. Yes. Because these are papers, words.
Because it's a legal responsibility on their part. And as the authority, if we find so we are submitting information that is not the truthful, then it means that if you are trying to deceive the public office.
Who better know when who saying you're truthful?
Except that's why they've signed a declaration when they are bringing the documentation. Said this information is a true reflection of what has gone on.
But at what point in time, now who said what they presented to you, a misrepresentation, and the facts.
Okay, so when they are bringing the document, they will bring the certificates of the analysis for us to review. And these are things that have been signed by credible organizations. It is not just the company on its own bringing everything. The document has to be certified by the releasing authority. And those ones, as what I said, Ghana, FDA, Ghana pharmaceutical company, IEDRO, and FDA, Sasha says this medicine has been done in the right way. It means that the Ghana has gone to analyze the sites and all the products and given that certification.
Good. Analyze the site and the products practically. Maybe why be a laboratory test in the Is it the case with AstraZeneca?
In the case of AstraZeneca, because it's under the COVAX, WHO has done some of those activities for FDA. So they've looked at the site, they've looked at the manufacturing processes, and that has given the confidence. So we as a country, we give the opportunities, what we call reliance. You don't have to also spend the same resources to go and repeat exactly what another organization has done, which is a credible organization. It's not just Obiake there you go.
World Health Organization.
Yes.
For the efficacy.
Yes.
They accept AstraZeneca.
Exactly. Now this AstraZeneca vaccine too, I want to say it has also gone through emergency use authorization in EU. European Union. Okay, so what happens is that AstraZeneca, we have a vaccine first, they took it to European Union, and then the European Union also reviewed the information, did all the analysis, and certified it. So they have also approved that medicine. Based on that, the WHO has also done the same thing, repeated all these processes of authorization, and approved it, and put it in the vaccines now available under the COVAX scheme for developing countries. So when you, as the country, receive that application, you also review this documentation and find out, say, okay, maybe the processes of monitoring the safety it will not be feasible as they are doing it in maybe Europe. It will request that they should do it in Ghana here. But when it comes to the safety and efficacy of that vaccine, it has been certified.
Okay. So two things, Yankasian, practical test, or has it because of the expense? No, that's the first thing.
Yeah,
secondly, because of relationship and World Health Organization, GDA woman review documentation, if he say okay.
Exactly.
Now, most of the time, some area, more situation into the environment. For instance, Ghana, more raise some concerns because of Ghana, a peculiar nature, circumstance, AstraZeneca.
So basically, we did not find any concern with the safety or the efficacy. The only concern we had was how they were going to monitor the safety in Ghana, process some go through, because what they have described is what will maybe pertain in Europe, and we don't have the same healthcare structure. Because Europe, you say electronic systems, Obia's data is on the electronic database. If somebody has any side effect on the medicine, they can just go in and follow up on it. But here we need to put in practical system that will suit our healthcare system, and that is what has been done. And we've communicated this to them, and they're also prepared to make sure that they implement it as per our guidelines and our requirements in Ghana.
Okay, right. Some questions for you, but me no ebi preko. Now, eti enya barbecue.
Exactly.
One caution so far, if any side effects. It means a side effect be anyone.
Oh, a drug beer and we are seeing my side effects in home. Because every medicine is a foreign product, equal body name. Into paracetamol, punko, fofa, sometimes they have very severe skin reactions, but they are rare. But we say paracetamol, they're very safe medicine. Into a drug beer and we are seeing side effects in home. And our vaccines near the man so BCG, uncola, polio vaccine, yellow fever. Definitely you can have some side effects. But the good thing is that most of these side effects that they've identified with the AstraZeneca vaccine, they are mild. And they are similar to the side effects for the other vaccines that we have. For example, headache, we feeling warm. And now, okay, ebia na utibe oya. And now ebia umubayeshi. Kakrande ana baby omawo panel no. Ebia hwa ayo pain be o hwa oya ana hwa aswa kakra. Into these ones no, okwadi any other vaccine na ohwe nkola pomco vaccine na o de do mo pain ombesu. Ebia wakase o na mama no paracetamol. And these side effects are there, but the good thing is that from clinical trials, these are the same as the other side effects from other vaccines. And now in UK, they've as at February, I think 7th, no more vaccinating more than 5 million people, and the number of side effects were very few, and all of them, any those things. The same thing with India. Or they had vaccinated almost 21 million people. Side effects, hunamia, pain. And if you look at it, it is not different from maybe hepatitis vaccine. Now be a okay. And now yellow fever vaccine. Now it's the same kind of side effect that we are seeing. The thing is, a new beer no side effects. No, these side effects no, maybe nipa 100 what maybe and the new beers now offer drop your side effects. The same way, no, and your beer no cause vaccine now, when your side effect. Ebumunya,
possible so ebenya much serious side effects.
Very, very possible. Very possible. And the International Food and Drugs Authority is keenly involved. And apart from say, Yashisha in Drunumneka say, a Yana Ghana engine tuning and vaccination, we have put in place a safety monitoring system. And now, and she share so binya so suboni bia obetumi report and now ma ebia swati nya hwehwem say so subon na wunya ye no e den na de baye e vaccine de baye na nya vaccine de baye nti ye an expert committee who are also there, and this expert committee doctors in Penifo they are about 9 number hwehwe sans nya FDA na ka say ya approve medicine no side effects bi an ho. These are medical doctors, they are independent on it, and that their reputation too is also there on the line. Until you can say, okay, vaccine in Kofunya and Ebia will be on your swelling. That you should swelling and because of vaccine, and that's when a vaccine. Into all these information and systems, and she shared, they say the moment the first person obey your vaccine, after the last person obey your vaccine, you better follow each and every one of them. As part of the vaccination, yes, EPI is having e-tracker system. Exactly. Into your e-tracker system. Into say, what vaccine now? With telephone number, baby, baby, what I say. Into this information, database. The database information on the FDA. FDA best send a message say once our vaccine will end there. Vaccine no ebeboa ema so when you COVID-19 infection but okay. You'll be fine. But say unya so boni bia fresh sa number way na oni FDA nkasa and now unya so boni bia your some app be a friend med safety app download it now complete information on say no feel it time now wo vaccine no time now so boni no e sha ase what I say into when you hand your beg information ya hwehwem into from time to time, you better say, so you vaccinated 100,000 people. No, I'm saying 100 in ya, 80 ya, maybe 200 in ya, hunamia, but every sabacon, unfortunately, or so called hospital because of that. But if you no, say ni say neti, vaccine their course here, and then you vaccine.
Wow.
Well,
and also more capacity. Some which me monitor. Sandy pay we say will be obey or fast process. We say we more capacity to monitor them and get feedback from them.
And get feedback. Information ever send them or with what text message, SMS. Into once Uji vaccine, your data is collected, and then that data is sent to FDA from EPI.
Okay.
Into then our IT department on send no text message. Either on the same day that you took the vaccine and not the next day. And once we send that text message, you are aware. And you will then have to inform FDA if you have any of such a side effect. You understand? But apart from that, so what we are going